Hi everybody, my name is Tommy and today we are transing so hard. I'm going to talk about hair removal today, something that in the trans community tends to be very important overall because so many of us have an issue with our body hair, specifically for male to female. Maybe a little bit for female to male, but I'm not familiar with that. So the reason I'm talking about this today is just because you can see, if you are able to zoom in real tight or not, I've got a little redness around my mouth because on Friday I did go for an electrolysis session and it has left a little bit of redness around my mouth, and I figured I'd leave that and not cover it up with makeup so you could see, a little bit of the short-term effects. That was 3 days ago now. So one of the biggest things that I hear from a lot of my friends is there is a lot of dysphoria around body hair, specifically facial hair, and then for other reasons we'll get into a little bit about groin hair and then body hair as well. During puberty, we know that hair growth patterns tend to change as a secondary sex indicator between men and women. And so if you've gone through the wrong puberty, you might end up with different hair patterns than you really want. Specifically around the face, we'll find that in cis women tend to have no dark hair around the face, but they'll end up with a little light blondie hairs maybe. Unless you're Italian, then you just get a full mustache no matter what. That's only for my Italian friends. Nobody else can laugh at that. In the groin area, it can be specifically important if you are getting GCS or GAS, bottom surgery basically, because in a lot of cases the surgeons will require hair removal so that they can perform their work in a specific area. But not every surgeon does require that. So check with your surgeon after you've found out who you want to use and find out what their requirements are, because they might have a different hair removal pattern. Some require no hair removal at all. During the process, the skin tends to be ablated, and that they go into the dermal layer and destroy all of the follicles, hopefully. But it is a process that is not 100% effective. Some studies, meta-studies, show that the rate of incident of hair regrowth after surgery is the same whether you've had or not had pre-surgery hair removal. Some surgeons say, why risk it? So either way, whatever you do, talk to your surgeon and follow their direction. The other places that people can consider hair removal is just the body in general. A lot of women, cis and trans women in general, shave their legs or armpits and remove the body hair there already. A lot of male tendencies are that there's a lot of arm hair, chest hair, back hair, belly hair, and maybe even thicker leg hair. Those types of areas for trans women can be really dysphoric for a lot of people because they're still presenting with a lot of hair. So I've had a bit of experience of a lot of this myself. I've tried many different methods of getting rid of hair, and I'm going to share my experiences with those different methods and just what was more effective or less effective and such. So first thing, what everybody seems to know, is shaving. If you are a trans woman past the age of puberty, you're probably familiar with having to shave your face. Heck, if you're a cis male, you probably are familiar with that too. And if you're a trans male, you can do that too. Most cis women are not familiar with that, so they're not going to be able to give us good advice on how to shave. But this is not a shaving tutorial. This is just pros and cons. So shaving, you can get a very close hair removal, which is good. For me, I would find that if I shaved with a blade more than every day, or if I shaved every day, that my skin would get irritated. I've got a fair amount of scarring along my neck from ingrown hairs and irritation that over the years I ended up picking at or just treating poorly. I had a little over 2 years ago, maybe 2.5 years ago, I switched to an electric razor, which was a Philips, the triple head, spinning blades, and I find that I can use that razor multiple times a day and not end up getting irritation. So if I wake up early and I shave before going out for work or whatever, and then at the end of the day going out for the evening I want to touch up, it doesn't really aggravate my skin too much. So that's kind of my daily maintenance, is going to be shaving. I have tried depilatory creams in the past, like Nair or Nads if you're in Australia. I find that it does tend to burn. I've used it on my legs, my chest, my belly. I tried it on my groin. I don't recommend it. Scrotal tissue is very sensitive, and that stuff burns. And so that's something that, if you're trying to get around the groin area and you just like a clean slate, that's not necessarily going to be the best thing to do, because really you are chemically burning away the hair, and anything that's that strong is possibly going to start getting into the follicles and really start hurting. The skin on your legs or your back or whatever is going to be a little thicker and tougher and more used to that sort of thing. Another thing I've tried, which frankly some people are okay with it, I had a hard time, was epilation. I had a Satinelle. It was a lovely pain-free epilator. No, it's not pain-free. Anybody that sells you an epilator that's pain-free is overselling their product, because frankly it grabs and rips out each hair, sometimes 20, 30 at a time. You can't do that pain-free. It tends to hurt. So depending on the area, now I could do it below the legs if I chose. The hair is fine, there's not much there. I could do that. And it would rip it out, and I've tried that along the chest area and ended up with a lot of blood around my nipples. I've tried it on my belly and ended up with blood. I tried it in my groin area and ended up with blood. So use at your own risk. Plus, when you start ripping hairs out, whether you're tweezing or using an epilator, you can start to cause damage to the hair follicles. And as the hair grows back, you're going to end up with bent hair, curved and twisty hair, possibly ingrown hairs, that later when you go for more permanent hair removal, you might have more trouble because it's hard to actually get into the follicle. The next thing that we're going to do is now we're going to kind of step into more permanent types of hair removal. All those previous things, they're temporary hair removal. They don't stop the growth of new hair. So laser is something that, in the 80s started getting really popular, and while it is not recognized by the FDA as permanent hair removal, it can be very effective. So the way the lasers work is it uses certain frequencies of light, and it basically carries heat into the follicle and uses the hair itself as the conductor of heat, which hair is a horrible conductor. So it has to be the right frequencies, trying to get in there and get the water to excite. Now remember also, I'm not a scientist, so if I get any of this wrong, just correct me in the comments. I don't necessarily need to be totally flamed for that, but sure, correct me if I'm wrong. But basically, using the correct frequencies, it generates a lot of heat within the follicle, destroying the follicle. Now, hair grows in 3 stages. Only when it's in a growth stage can it be destroyed. And my understanding is there are certain chemicals within the follicle that during the growth stage are present and make it where that frequency is actually going to destroy the follicle and the skin surrounding tissue. Otherwise, the hair will come out and it'll regrow the next growth cycle. So what do you do for laser is you start off with a nice clean shave. You want the hair to be as short as possible, because you don't want any of that energy absorbed by hair that's already outside your body. It's a waste of that energy. You want it all focused on the hair as it's inside the follicle. And so you shave and then get treated. Now, different frequencies of laser are going to work on different colors of hair better. Ideally is the lightest skin possible and the darkest hair possible. That's where it's going to work the best. And even then, you're looking at 5 to 10-ish laser treatments to get all of the hair as gone as it's going to be. Blonde hairs on fair skin is not going to work very well. You're still going to end up with those blonde hairs. So if you're already very naturally blonde and your hair is fine and blonde, laser's not going to do a lot for you. If you have a high contrast, though, laser can be very effective and a good way to shorten the amount of time it takes for full hair removal of an area, because you get rid of all the dark hairs quickly with a laser. Though it takes a lot of sessions, each session is pretty short. And also, there's a lot less pain associated with laser than there tends to be with electrolysis. So while it can feel like a little bit of a snap of a rubber band, it is not terribly hard to put up with. And then finally, after we talk about laser, some of the good things, let me get that real quick. Laser, like I said, you can get a full clear pretty fast and do each session like 4 to 6 weeks apart, depending on what your laser tech will say. Like I said, over 6 months, maybe a year, you can have a lot of hair gone in a year. Some of the cons are the light hairs don't get fried. There is sometimes a redness that happens afterwards that's kind of almost looks like an irritation or rash. Some people react better than others. You still want to stay out of the sun afterwards. So it can be a bit irritating in that regard. And that's, the worst thing is just you can still see a lot of hair regrowth sometimes, and it's frustrating to see that over time. And then we're going to move on to electrolysis now. And with electrolysis, there's a number of different ways that electrolysis works. Galvanic electrolysis uses a specific frequency when they insert a needle into the hair follicle, and that frequency turns one of the chemicals within the follicle to lye and chemically burns out the follicle. That is the best known way. Previously, this took a very long time to happen though. And more recently, with microcontrollers and computer-controlled electrolysis machines, they've been able to shorten that timeline down, so you don't have to have a probe inserted into you for 3 minutes to burn out a hair. It can be, a couple of seconds at just the right frequency for just the right amount of time. Another way is thermolysis. And thermolysis is also the needle is inserted into the follicle, and in this case, the frequency or the electricity that's in there is enough to basically heat up the water within the follicle and try to burn out the follicle that way. One of the problems with thermolysis is that it also tends to superheat the surrounding tissue and can cause a little bit of irritation and scarring afterwards. Again, these methods do kind of hurt because you are basically burning, whether chemical or through heat, you're burning out each individual hair follicle. And the next one is going to be a blend of the two. So the current is used to get that lye action going, and then the heat, and try to burn them out. And so that's something that's used to have a quicker result per follicle, but you sometimes have to treat each follicle multiple times. So most recently, I had galvanic done with computer-controlled galvanic, and I've went to a place that does injections, and they did dental blocks. So they actually numbed up around my mouth, as you would at the dentist, and completely numbed my lips. So I mean, you're just flappy numb, and they cleared my entire upper and lower lip. Now these are the most painful spots on my body. I've been tattooed up and down the arms, even the sensitive spots, down my back, piercings through, well, every genital piercing you can think of, all sorts of tender places. And the absolute most painful spot on my body to have a needle do anything is right here. I felt nothing, and it was glorious. So that was a wonderful thing. We'll probably do it again if I have to, because it will take a number of clears to get all of this hair removed. Just because they pulled it out doesn't mean that follicle was currently growing. Possibly there was nothing there at that time because it hadn't been in a growth cycle. I also had a little bit of the chin done, again with injections this time to numb up the area. And again, didn't feel anything, and it totally was worth it. Some people have an issue with injections because there is a low incident rate of, what's the term? Sterile abscess is something that can happen with injections. And in that case, it just means that a small pocket can form within. So it's not necessarily infected, but a pocket where that injection went could form. So you want to make sure that your injections are performed by a nurse who is familiar with giving injections. I would say that of the types of hair removal, the electrolysis has been the most effective. Now granted, I've had coming on 70 hours of electrolysis so far, varying types, and I've had over most of my body 8 sessions of laser hair removal, depilatories in certain areas, and all sorts of things. Electrolysis seems to be the most helpful. Laser probably the second most, but I would recommend for speed and for cost to do laser first to remove as much dark hair as possible, and then follow up afterwards with electrolysis to remove the lighter hairs as needed. So what's your experience with hair removal in general? Leave notes in the comments, please. Let me know how your experiences went and what's your preferred method. And if you have any questions, let's start a discussion. Thank you very much for watching, and have a wonderful day.